My name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with muscle, bone, and joint ailments, starting with the letters O through R. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address the issues of your skin, nails, hair, eyes, ears, nose, heart, blood circulation, teeth, gums, lungs, respiration, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and then specific to men. Then issues of the hormones and metabolism. After that, I'll address the issues of homeopathic remedies on infections, infestations, and the immune system. Then issues surrounding fertility and pregnancy and surrounding childbirth and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence, and finally special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone's a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or Arsenicum album types, those who react strongly to Arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature mirror people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, ganglion, of stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. And an account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with muscle, bone, and joint ailments, starting with the letters O through R. The body is a wonderful system of bony levers and casings bound together by ligaments and moved, supported, and protected by muscles. Where bones meet, there are joints. Most joints are enclosed in a sleeve or capsule of tough fibrous tissue lined with cells that secrete a special lubricant called the synovial fluid. The ends of the bones themselves are covered in a special kind of cartilage called hyaline cartilage, which is smooth and tough and nourished by the synovial fluid. The fluid and the smooth articulating surfaces of the bones ensure friction-free movement. The largest synovial joints in the body occur at the shoulder, elbow, hip, and knee, and between the pelvis and sacrum. There are other kinds of joints too, although these occur in lesser numbers. The weight-bearing surfaces of the vertebrae, for example, are separated by discs of fibrous cartilage with a tough outside and softer inside. The vertebrae stack up one on each other, separated by the shock-absorbing discs. The knee, because of its both load-bearing and free movability, has a fluid-filled joint capsule with two partial discs of cartilage inside it. Where muscle tendons cross joints, there are special anti-fraying strictures called bursae, which are small fluid-filled sacs of connective tissue. There are bursae above and behind the knee, at the top of the femur and humerus, at the back and front of the elbow, and so on. The knee is unique in having a small shield of bone, the patella, in front of the joint. Without it, kneeling would be impossible, and the tendon or the quadriceps at the front of the thigh would soon wear through or get nipped in the joint as the knee straightened. Every joint in the body has its own range of movement. The shoulder has the greatest, followed by the wrist, the head and neck, and the hip. Healthy ligaments check joint movements, keeping it within stable limits. Healthy muscles, whose inelastic tendons insert into bone close to the joints they move, also keep joints within stable limits. An extramobile joint, therefore, is not necessarily a healthy joint. A hypermobile joint in the spine, for example, usually means that the other vertebral joints are not as mobile as they should be. If muscles are weak, giving little stability or protection to a joint, the task of stabilizing and protection falls entirely on the ligaments and the joint capsule itself. Unlike muscles, ligaments and joint capsules have no contractile powers. They can only stretch. With traumatic or habitual strain, the joint becomes inflamed, causing stiffness, pain, swelling, and loss of mobility. It may even dislocate, becoming useless because the fulcrum against which the muscles exert their leverage has fallen apart. If trauma is sudden and severe, ligaments tear, tendons rupture or rip away from their bony moorings, muscle fibers break, and bones fracture. However, most of the muscular aches and pains that take people to their doctor, osteopath, chiropractor, physiotherapist, or acupuncturist do not have such spectacular causes. They are the result of poor posture, depression, anxiety, occupational demands, lack of exercise, and the slow process of aging. Bone, contrary to popular conception, is one of the most active tissues in the body. It is well supplied with blood vessels and is continually repairing and remodeling itself in response to stress and load. Exercise and sufficient calcium and vitamin D in the diet encourage growth, maintenance, and repair. In fact, calcium is continually exchanged between the bones and the blood in order to keep sufficient calcium in the blood for nerves and muscles to function properly. In an adult, the manufacture of blood compounds, red and white blood cells, and platelets is carried out in the marrow inside the vertebrae, breastbone, ribs, pelvis, and heads of the humerus and femur. Osteoarthritis. Osteoarthritis comes on with age, injury, or overuse. The cartilage covering articulating surfaces of the bones breaks down, and the underlying bone becomes thickened and distorted, restricting joint movement and sometimes causing episodes of inflammation, pain, and swelling. The joints most commonly affected are the load-bearing ones, the hips, the knees, the spine. 90% of people over 40 have some degree of osteoarthritis in one or more joints, and this condition can be aggravated by being overweight, or by an over-acid diet and by laxative abuse. Conventional treatments include painkillers, anti-inflammatory drugs, steroid injections into the joints, physiotherapy to prevent muscles from wasting, and replacement of worn joints, especially the hip, with artificial ones. Hip replacements have a high success rate, but may themselves have to be replaced within about 20 to 30 years. Homeopathy offers constitutional treatment if osteoarthritis is chronic, but for isolated flare-ups, the remedies that follow should be tried. If they do not improve matters, consult your doctor. Many sufferers get great benefit from massage, chiropractic and physiotherapy, naturopathy, and acupuncture. Specific remedies to be taken 4 times daily for up to 2 weeks. For pain that is relieved by heat but aggravated by cold and damp and is more insisted when resting, but wears off with continued movement, and the stiffness is worse in the morning, use Rhus Tox 6C. For severe pain that is made worse by heat and movement and is relieved by cold applications, use Bryonia 30C. If heat in warm rooms makes the joint pains worse and the person feels weepy, use Pulsatilla 6C. If the affected joints feel cold and numb, with pain and stiffness increasing with weather changes, and there is weakness upon climbing stairs, use Calcarea Phos 6C. For the after effects of steroid injections or for small joints, especially the toes, which give pain and make cracking noises, and joint pains seem to progress up the body and the pain is relieved by cold applications, use Ledum 6C. If the joint pains are a consequence or made worse by injury, use Arnica 30C. For severe flare-ups in cold, dry weather, use Aconite 30C. Self-help. 2/3 of osteoarthritis sufferers find an alkalizing diet beneficial. Stick strictly to the diet for 1 month and see if it helps you. Take some of the weight off your joints by using a cane or by losing weight. Sleep on a firm bed and take several short rest periods during the day. Don't give up on exercise. Your muscles need regular exercise to keep them strong. If you're severely disabled, contact the Arthritis Foundation for information on special equipment, such as long-handled dustpans, retrieving sticks, electrical plugs with handles on them, and things of this nature. Vitamin A, B, C, and E, and also iron, zinc, copper, selenium, and manganese would certainly be beneficial. Restless leg syndrome. Restless leg syndrome is a tickling, burning, or prickling sensation in the lower legs, causing involuntary twitching and jerking. The condition affects 5 to 10 people in 100 and seems to be nervous in origin, partly hereditary, and is often associated with diabetes, iron or vitamin B deficiency, drug withdrawal, or overconsumption of caffeine. Orthodox treatment consists of painkillers or tranquilizers. Specific remedies to be taken 4 times daily for up to 14 days. For legs twitching and jerking with an irresistible urge to move them all the time and yawning, use Tarentula 6C. Use Tarentula 6C, like the spider. For legs always on the move, with general restlessness, anxiety, and feeling chilly, use Arsenicum 6C. For twitching that is worse when lying on the right side, especially in an elderly person with limb tremors, catnaps seem to steady the limbs. Use Phosphorus 6C. For trembling, twitching feet and restless legs, even when asleep, use Zinc 6C. For legs jerking, twitching, and trembling, and feel itchy and tingly, and becoming even more uncomfortable in cold weather or in early sleep, causing the person to wake with a start, use Agaricus 6C. For legs jerking and going into spasm, the person feels generally hot but has cold extremities. Slightest jarring makes jerking worse. The discomfort increases when trying to go to sleep. Use Belladonna 6C. If the problem comes on after grief or a broken love affair, the legs jerk in sleep, causing the person to wake up in despair of ever sleeping again, use Ignatia 6C. If the jerking is worse between 2 and 4 a.m., use Carb 6C. If the twitching and jerking is worse during the day, but helped by exercise, use Sepia 6C. Self-help. Warmth. Warm socks or a hot water bottle is the best treatment for jumpy muscles. Make sure your diet contains plenty of folate and vitamin E. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.